In general, we've got obviously patients that were involved with the blast and burn injury, and so we're in the early parts of the management of these patients, and so it really depends on what the extent of injuries are. But when you have a burn patient, I know Dr. Korentager can talk more about that, but from a trauma standpoint, we really are concerned about bad brain injury. We're concerned about bad lung injury that can occur from blast effect, that can damage the small sacs that help with ventilation and oxygenation, the alveoli, and that can cause significant damage. And you can have internal injury, which can occur secondary to that, such as to the solid organs of the body, liver, spleen, and spinal column and other bony areas. And so you've got the blast effect that occurs and that causes immediate damage. You've got then a secondary effect from being thrown by the blast against other objects that can cause other injuries, fracture patterns, and all. And so there are a lot of things that occur. And then when you throw burn injury on top of that, I think Richard is more qualified to discuss that. I think just by virtue of being in a blast injury to that magnitude, you would either suffer either from on a small range a concussion, but that can be significant injury, and we've seen with our wartime experience that has caused a significant amount of traumatic brain injury, even when you don't see any problems with on the images of the CAT scans or the MRIs, and then ranging all the way up to significant injury, and that's typical, and that's what we're seeing.
The burn injuries, it's somewhat analogous with the things that Dr. Moncure was talking about with the trauma. It's almost as they're the sprinters and the short distance part of the race. In burn, we're sort of the middle distance and the long distance part of the race. So in the burn injuries, what we see, and we've got a lot of experience with this because we're the only sort of adult burn center in the region. What we see is that there can be early problems that develop with tissues that don't survive, so the burn tissues that don't heal, that are going to need to have surgical treatment. And then we also see in a more of a delayed fashion, we're going to see problems with their lungs, problems with nutrition, and those can take a longer period of time to manifest themselves. With these severe burn injuries, people, it may take a month or more until they're at a point where their wounds are healed, where we're able to get them into sort of a rehabilitative phase of their recovery. And that can go on for literally months or years. And with these severe burn injuries, especially ones that go across joint surfaces in the extremities, there can be a lot of tightness that can develop. We'll often need to do delayed reconstructive surgeries later on in those patients. Well, in these individuals, we've been seeing burns ranging in the 25 to 30% of their body surface area. So we consider those to be very significant, very severe burn injuries. But really it's the combination of the severe burn along with the trauma. And that's really the unique thing, the partnership that Dr. Moncure and his group and my group have, Dr. Bavsar, who's our director of the medical director of the burn unit, and Dr. James Howard, who's also medical director of the burn unit. Each of them is in one of our departments, and so that partnership really allows us, I think, to give these people the absolute best care possible.
Big things are when patients come in shock. We're trying to resolve that shock, and we have different labs and different numbers that tell us when they've resolved the shock. And our data shows us that if you're able to resolve that within 24 hours, the chance of them dying is much less. So that's one big thing. When you look at major brain injury, the brain is just like if you bang your elbow, it swells, and it usually swells for up to about 72, 96 hours. So once that is stopped, as long as there's no more infection, no more insult, that starts to plateau and then it starts to resolve. So that's a big key deal. And then when you have significant lung injury, that can be anywhere from a couple days to a week or more. where the lung just starts to stabilize and then starts to heal itself, and you're able to get that patient off of the ventilator. So those things are I think, key. And then, from a burn standpoint.
From a burn standpoint, we have to regain sort of coverage of the body with skin. And we really can't breathe a big sigh of relief until it's essentially all the wounds are covered. And sort of the rule of thumb that we generally will say, about 1% burn is 1 day in hospital. So, we think with about a 25 or 30% burn, hopefully within, somewhere around 3 weeks, we'll have them essentially completely covered with their own skin, and then we can relax a little bit. But until then, we have to be, very vigilant and really on guard for potential infections or, other things that can set the patients back.